Obviously stop smoking so you don't end up looking like that, but there's some other things we can do to prevent cardiovascular disease.
That's correct. Exercise is big, managing high blood pressure is big, managing diabetes, that also will help.
You mentioned diabetes. That's a big player in Kentucky and a big risk factor for cardiovascular disease.
Absolutely. As a matter of fact, in medicine, we count known diabetes as a coronary artery disease equivalent. What that means is if you have diabetes, it's the same as having known coronary disease. That's how big the risk is.
So it's important to keep your glucose under control. Your A1C ought to be what?
Well, it's different for different people. If you're looking at a child or an adolescent who's been diagnosed with diabetes, we want a little tighter control. We're going to look at something in the order of 6.5 to 7%. If you're looking at someone, an adult with newly diagnosed diabetes, then we're going to look at somewhere between 7 to 7.5%. If you're 75 years old, you've had diabetes for the last 20 years, then we're going to be happy with an A1C of 8%.
Now you mentioned that's numbers for diabetes, but there's also cholesterol numbers. And with the new risk calculators, the numbers not necessarily as important, or is it?
The numbers aren't as important as we used to think that they are. With the new calculator, what it does is give you that percentage of a risk of having a heart attack or stroke over the next 10 years. If your risk turns out to be 5%, then we want to see a 30% reduction in your LDL from its baseline. If your risk is 7.5% or more, then we want to see a 50% reduction. So the individual number isn't as important.
And you can get that number and kind of help guide you through that process by seeing your primary care provider.
Absolutely, and they're also going to talk to you about lifestyle modifications.
Okay, you mentioned that. Obesity is huge. How do I know if I'm too fat?
Well, you can go to any of your online search engines and put in body mass index, and it will give you a way to calculate that. What we consider normal is a body mass index, or BMI, of 25. When your BMI hits 30, then you're obese, and when it hits 40, then you're morbidly obese. At 40, morbidly obese, that means that you are so fat that it's going to kill you.
Well, and that's just the truth. That's what will happen. So to prevent that, obviously there's diet, but there's exercise. Are there some goal numbers that you want to do, or some exercises that you want to do?
The current recommendations for adults are going to be that we want you to do 150 minutes of moderate intensity exercise per week, and that needs to be in divided segments. Moderate intensity is going to be defined as a heart rate above 100 beats per minute, and we want to sustain that. So what I like to do is I call it the rule of fours. 4 days a week, 40 minutes, 4 miles an hour. Most adults can achieve a heart rate of 100 beats per minute by walking at a pace of 4 miles an hour.
You want to start slow? Do you need to see your doctor before you start that?
Both of those. You want to see your doctor, you want to get a clearance, and then you want to start out slow. You want to challenge yourself a little bit, but you don't want to push it to the point that you hurt yourself or that you keep yourself from going back.
Okay, let's